Hi, welcome. I'm Lori Saunders. I'm the center manager here at Vitality Women's Clinic in Godfrey. I'm going to take you through a typical day of a patient experience, a woman that comes in for our medical services here. So a typical patient's going to come into our very warm, inviting reception area. The colors are very warm, and she's going to feel very embraced, and she's going to feel very comfortable, not like your cold, sterile clinic. She's going to meet with an advocate who's going to walk her through all the options of an unplanned pregnancy. We're going to talk about abortion. What is abortion? What is it not? What are the potential risks and side effects that a woman needs to know before she makes that decision? We're going to talk about adoption, how that has changed over the years, open adoption versus closed adoption. Research shows that an open adoption is better for birth mom and family and child, so they each know the whereabouts of one another. And then we're going to talk to her about parenting and what that might look like if she chooses to parent. The wraparound support that we provide and also that the community provides. We have online classes that she can take, anything from breastfeeding to budgeting, life skills, those kind of classes. And it's an earn while you learn program. So she's going to earn points along the way so she can get the things that she needs in our resource shop: diapers, wipes, baby clothing, the bigger items like cribs and car seats, pack and plays, high chairs. Because of course it takes money, right, to raise a baby, to have a baby. So we're mindful of all those things, and we have that. We're also going to talk to her holistically. Is her spiritual life important to her? Especially in a decision-making process like an unplanned pregnancy. And so we can talk to her about, is her faith important to her? Is that something that she's leaning on or considering? And we can talk to her about the gospel of Jesus Christ, what we believe here, and invite her into that setting. If that's something that she's never put her hope in, we can explain what that means. We're also going to talk to her about the support that she has in her life. Does she have family walking alongside of her? What about the father of the baby, the partner? Is he going to be involved in the decision-making process or afterwards? Does she have a church family? Is that something that she has already in place, somebody that can provide that support, community support as well for her? And then she's going to meet with the nurse. The nurse is going to talk to her about the STD testing. That's very important, especially for a woman considering abortion. She needs to know, do I have an STD? And if so, she needs to be treated for that before she would go through any kind of invasive procedure like an abortion. And we can do all that testing and treatment here for free. All of our services are free and confidential. Then we're going to talk to her about the ultrasound. The nurse is going to do an ultrasound on her to determine the viability of the pregnancy. Is it going to be a good pregnancy, or is it going to end naturally in miscarriage? Then she would have no need to go through with an abortion. And then also, what about the pregnancy itself? Is it located inside the uterus as opposed to outside in one of the tubes? That could be a dangerous situation. She needs to know that before she would choose abortion. And then how far along is she? We're going to do some measurements on the ultrasound that'll let her know how far along she is exactly. Then we're going to refer her out into the medical community or follow up with her as needed. It's a limited scope of OB medicine that we are practicing here until she makes that decision or until we can confirm viability of the pregnancy. We're going to wrap up that appointment with resources and referrals. As she leaves that day, is there anything else that she might need, like housing or job assistance, food assistance? All of those things are on our resource and referral list. And then we're going to ask her, does she want prayer for anything in her life? And we're glad to provide that, or we're glad to go back and talk about other things if she's not interested. So it truly is a holistic experience where we're meeting her physical needs, her emotional needs, and her medical needs, and then also spiritual if she's open to that. So that is a day in the life at Vitality Women's Clinic. Thanks for joining me today.